Ashley, I'm an occupational therapist here at Therapy Playground.
And I'm Kim, I'm also an occupational therapist at Therapy Playground.
Today we're going to discuss some of the commonly asked questions we get as occupational therapists. The first one, what is occupational therapy?
Occupational therapy is a form of therapy that works with people to help improve their functional independence on activities of daily living. That's the textbook definition. We help people to get better to do the things they have to do every day.
Exactly. How about OT versus PT?
It's a great question, especially working in the pediatric environment like we do. There can be a lot of overlap and a lot of similarities between occupational therapy and physical therapy. But in general, OT versus PT, occupational therapy is going to work on, again, those functional independent skills, helping people to become better at feeding themselves, become better at dressing themselves, navigating what they have to do during the day as functional independent individuals, whether they have a hard time after an injury and recovering from that injury or from that surgery, or as children developing these skills that they just seem to be stumbling over some obstacles. Physical therapy is working more on the physical mobility of those things, navigating a person's environment, getting to and from where they need to go while they're doing what they need to do.
One of the questions that I get most often is, why does my child need OT if they don't have a job?
People might laugh at that question, but it really is not a bad question, and if you're not familiar with what OT is, it makes sense. People hear occupational therapy, they think occupation, they think job. Think of occupation in terms of your job of living. OTs help you to be the best that you can at your job of living, no matter what you have to do during that life.
What ages and diagnoses do occupational therapists work with?
Occupational therapists can work from newborns up into people at the end of their life. We can work with newborns in the NICU after they're born with feeding difficulties, or we can work with toddlers and preschoolers learning to develop new skills, work with school-age children. We work with children who have developmental challenges. We work with children who have, again, recovering from a broken arm or an injury or a surgery. We work with adults recovering from injuries or surgeries, and in the geriatric population, again, recovering from an injury or an illness. So really, OTs work from newborns all the way to the end of life.
Excuse me. Do OTs work with just handwriting in pediatric?
No, sorry. Absolutely not. Handwriting is a primary component of what pediatric occupational therapists do, because pediatric OTs tend to focus on functional hand skills. And as a child, particularly a preschooler or school-age child, OTs need to help those children learn how to write. That's just a huge component of what they do every day at home and in the classroom. But OTs can work on feeding, helping the children to learn how to feed themselves, helping them to learn how to dress themselves, helping them to learn how to improve visual motor skills, even just basic play skills, manipulating tools and objects and toys in their environment. This is a question that you're going to ask later, I think, but sensory concerns as well. So there's really a whole bunch more than just handwriting that OTs do.
Now, I know speech works with kiddos to address feeding as well, but how exactly does OT address feeding?
OTs can address feeding from kind of two different angles. The most common one is going to be getting the food from the table to the mouth, helping children learn how to properly hold and manipulate utensils. But there are some therapists who are trained in oral motor techniques that can help with the manipulation of the food within the mouth to assist with swallowing. The big difference is going to be speech therapists are going to really do the swallowing and the oral part of it, but some OTs can overlap into that side of it if they've been trained to do oral motor techniques as well.
One big question, how do I know if my child has sensory issues?
Sensory issues is a very general thing, and it can take a long time to talk about that, and that would be a great topic for a podcast in the future. Basically, in general terms, sensory issues means that a person, not just a child, but a person is having a difficult time taking in and processing and working with the stimulation they get from the environment. all the things that you hear, you see, you touch, you feel are sensory. And if a person or a child is having a hard time dealing with those forms of input, it might look like they are having some behavioral challenges. It might look like they are avoiding situations. It might look like they are seeking out certain types of input that are maybe inappropriate or unsafe. An OT can ask you some questions, give you a screening tool, a questionnaire to fill out, and kind of work with you to determine if the concerns you have for your child are related to sensory processing difficulties.
Along those same lines, do you think my child has autism?
OTs work a lot with children on the autism spectrum. And so, is my child autistic is a question that we do get often. It's important to remember that as occupational therapists, we cannot diagnose a child with anything, especially a diagnosis of autism. What we can help you with is to determine if your child is showing some signs or characteristics that are commonly seen in children that have autism spectrum disorders. Remembering that just because your child may show some sensory things doesn't mean that they necessarily have autism. But we can help you to work through some of those questions and those concerns and lead you to the right professionals that can do a diagnostic testing and confirm or deny a diagnosis of autism.
Well, great. Thank you very much for answering all these questions for us.
No problem. Thank you. Have a great day.
No, even just a little introduction is making me nervous. Can we have a sign on the door? Because people will probably bust down in here. Okay, hang on.
Would you like me to do the intro?
No, that's okay.
Okay.